Hi there, my name is Dan Ropek, and most likely I'm going to be your instructor for the anatomy and physiology class and the lab class that you've signed up for. The purpose of the demonstration I'm going to give you today is to help people become more comfortable and more familiar with the specimens that we're going to be using and the procedures for the class. This can be a difficult area for some people, I realize that, and I thought it might help to show you around a little bit here to get you more familiar with the materials that we use and the specimens that we use. I think the hardest part is just that. It's feeling comfortable having seen the materials, specifically having seen the specimens. And if you can do that through this video, then when you come to class, I think you'll feel a lot more at ease and comfortable with what we're about to do. So sometimes people have questions about it, and I thought this is a good time to talk a little bit about the questions that people have about the specimens. We do use cats, and the question that comes up often is, well, why are we using cats? This is a human anatomy and physiology class. And that's true, and ideally we would use human specimens. In fact, there are some colleges, some community colleges that use human specimens or cadavers. But you really have to design the class around that. You actually have to design the buildings around that. And we were really not ever set up to do that. So instead, what we're going to be using are these cats as a representation of the kind of body form that humans have. In addition to using the cats, though, we're also going to use human models. And so between the cats and the models, I think we'll get a very good idea of the anatomical forms and the actual tissues that form the body. So that's kind of why we do that. Secondly, the question comes up, well, where do we get the cats from? And I think some people have the impression that, maybe we're kidnapping them off the streets or something like that, and that's not the case. We buy them from a biological supply house, and the biological supply houses, as far as I understand, get them from places like humane societies, and some of them might actually come from research. But the point is that these are animals that already will have expired. None of them are killed specifically for using them as specimens in the class. So I think that eliminates, at least for me, some of the moral objections as to why we might use cats. They were either going to go into a landfill or we can use them in the class, and that's basically why we do use them. All right, this is some of the materials that we're going to be using for the lab, and there's a couple things that you should be able to see right here. First of all, there's the cat. It's in the plastic bag, and we'll be talking more about that in a second. It's sitting on the tray that you can see here that has a kind of a rubber lining on it, and that we'll be using that for these specimens. I think, as you can see, although this cat's a little long, it fits pretty well into the tray, and this is something that we'll be depending on to hold the specimen and to catch any fluids and things such as that. Okay. The other thing we want to look at here are some of the utensils that are going to be used. We're only really going to need a few, and I've got them in this little beaker here, and I wanted to go over each one with you. These are some of the implements that we're going to be using, and we really only need a few that they're here in this beaker. Start with this one. This is a blunt probe. Okay. This is a sharp probe, and it's just basically something that's got a very pointed end to it. Scissors, just regular scissors. And again, something that you'd see in your house, some tweezers. Okay. And finally, we've got a scalpel. Now, I've kept the cover on the scalpel because they're very sharp, and we may or may not actually have to use this implement, but I wanted you to see it anyways and know that it is possible that we might be using this in class. I'll go over more about how each one is used as necessary when we go through the procedure. Okay, so a minute ago you got a view of the cat, and as you can see, it's here in a plastic bag. The cat's actually inside a couple of bags here. There's an outer one and an inner one. And in between there's some fluid. That's basically a fluid that preserves the tissues of the cat. And if we're going to use them more than once, and we certainly are, we want to be able to keep these cats in as much of that fluid as possible. so that they don't get dried out and things like that. So what I'm going to do here in a moment is I'm going to cut the outer bag and show you the cat, take the cat out, and we can then look at the specimen in some detail. So what I'm going to do first here is to cut this bag, but I'm also going to put on some gloves. Gloves are things that are really a basic part of the class when we use specimens. We have different kinds of gloves for people that have different needs and different sizes and things like that, but you'll have gloves available for you. I'm going to put some on and then go ahead and take the cat out of the bag here, okay? So I use just kind of the regular latex gloves. Hopefully this will fit me. Should be size 9, large. And put on another one. Let's see here. There we go. Okay, and I'm going to use the scissors. So I'm going to use those. The rest of the implements for now, just move them out of the way. Like I said, you can see the cat here, the kind of head end and the tail end, and we'll cut the plastic bag near this far end. Let's see how this goes. They're kind of vacuum packed in here, so it lets some air in right away. Okay, so there we go. Kind of opened it up here a little bit, and like I said, there's 2 bags. So what I'm going to do now is I'm going to pull the cat out. As you can see, the second bag is still there. First bag's nice and clean. There's no fluid or anything in it. I'm just going to set that aside over here. So now I've got the cat out, and let's see here. Got to cut this one too. I'm going to go ahead, take the scissors, and let's see where to cut. Right there. Go ahead and do that. When we get all done, we're going to be taking some string and tying the end of the bag, and that helps to keep some of the fluid from escaping. Okay? So now we've actually opened it up, exposed the cat sort of to the air here, and the best way to do this is you've got a tray here, is to make sure that you hold the cat over the tray, pull it at an angle like this. I've just put my hands in here and grabbed the feet. I'm going to let it out kind of slowly. I don't know if you can see this or not, but there's some fluid that's accumulating at the bottom of the bag, and I'm letting that happen as I pull the cat out. Just going to continue to do that, and there we go. I've got it on the tray there. That wasn't so bad. I'm going to fold this bag over, and we want it to kind of sit up right so that it doesn't spill all over the place. Okay, so here's the specimen. Now I guess you can see it a little bit better. As you can see, the cat has been skinned. That's going to save you a lot of work, because some cats that you buy from biological supply houses, they have the skin on them. You have to take that off, and that takes quite a bit of time. So the skinned cats are good. I try to buy those type of specimens for you. There's a little bit of skin up here around the head and the neck area. We can kind of get a look at the cat now. You can see the tissues. I'm going to turn it over. Kind of see the back. And that's what we're going to be working with. What I'm going to be doing in a moment here is we're going to be using some of the implements. I'm going to just kind of demonstrate how we work on getting muscles of the cat exposed. I'm not sure how well you can see this, but there's kind of fatty tissue around the cat, all over it. Underneath the skin, there's a tissue called fascia, and the fascia contains connective tissue, which includes some fat. And the problem here is that when you want to dissect to see muscles, for example, you have to remove enough of this tissue so that you can see the underlying muscles. So you actually have to remove some of this tissue. And we're going to be working on it. I decided that what we can accomplish here in a little bit of time is to look at some of the area of the shoulder here, and I'm going to demonstrate a little bit about how we can make a dissection or do some tissue removal that will expose some of those muscles in the area of the shoulder. So we've got a close-up here of the area around the shoulder of the cat. Now you can see like the neck area here, and there's the arm. This is just basically the posterior, the upper posterior, the back of the cat. And got my tweezers here. So really, tweezers are excellent for doing a lot of the removal of tissue that you're going to want to do to see the muscles of the cat. Now, I don't know how well you can see this, but right there is some connective tissue. Again, we could call this fascia. Some of it is fat. Below that is some darker tissue here and here. Those are actually the muscles. Those are some of the things that we would want to define or to make clearer when we do our dissection. Okay? So that's what I'm going to be working on right now, give you some idea of how this works. And again, tweezers work very, very well. So I'm just going to go ahead and take the tweezers and tug a little bit on this tissue. Now, really the trick is to go slow, okay? Don't feel like you have to rush. You can see what I'm doing here as I pull up. And if you notice this, it's got kind of whitish, it's kind of cottony material. That's the material that needs to be removed, okay? That's not muscle. It won't harm the cat to remove that. But if you get any further down into this darker tissue, and if that starts to tear, then you'll have a problem because, in fact, that's the muscle. So I'm going to go ahead and try to tug away at some of this fascia. And it's coming off pretty well. In fact, you'll be lucky if your cat's fascia tissue comes off this well. This is actually very, very good. So I'm just kind of pulling away at it. Again, the cottony material's coming up. You can use your thumbs, as I'm going to help to do a little bit there. Pull down a little bit on that. Just keep tugging at it. Get more and more of the tissue coming away. Again, it's kind of clear. You see through it. That's the tissue that we're trying to remove. Okay? So I'm getting to an edge here where there's some, looks like some muscle. So I'm going to kind of stop there. I'm going that direction. I'm going to be tugging down a little bit and continue doing that. Okay, I'm going to grab another tool while I'm here. I'm going to pull it over. This is one of the things I talked to you about before. It's a thing called a blunt probe. So if you can see the blunt probe there, you can also be using that to help to separate some of the tissues. How do you do that? You usually pull with your thumb and then use the blunt probe to just kind of push into the tissue. So again, you're seeing that I'm getting some of the stuff off here. It's being removed. The blunt probe is helping me. I won't really tear anything with that blunt probe, so I'm in pretty good shape with that. And that's why you want to use a tool that will get you what you want and not cause a lot of damage otherwise to the tissues that you want to see. Okay, I removed quite a bit here. You can kind of see it there. I'm going to go ahead and I could tear it. That might work, but I'm also going to use my scissors now. So I'm going to go ahead and use the scissors since I've got quite a bit of tissue I know that I don't need. I'm going to cut kind of along the edges of that. There's a little bit of muscle there, but that actually is from the skin, so that's okay. I'm going to cut down along there. And, okay, a little bit more here, pull that off. Okay, so I've got some tissue. This type of material that I've taken off here, you'll need to kind of account for that. You're going to have to maybe keep a paper towel. I don't have one here, but eventually put it in a piece of paper towel and then wrap it all up, and then that can go in the garbage. Okay, we don't want to have a lot of loose pieces of tissue left when we get done with the lab. Okay? Okay, so we're continuing. What I'm going to be doing here in just a minute is I'm going to actually name a few of the muscles that we've exposed here with the cat. We've removed enough of the fascia and the fat, and I'm doing a little bit more here now so that we can actually see some defining areas of muscle. You probably can tell now that there's something here, kind of runs along this direction. There's another muscle that seems to come around the shoulder area here. Move a little bit more tissue. This broad kind of flat area right there. Okay, so we have one muscle here. We have another one here. Then you can see something that's running up sort of towards the neck at an angle. There's another muscle there. I'm going to define that just a little bit more. Let's see, what do I want to use here? I guess the tweezers are good. Move a little bit more tissue. And once you get the muscles kind of in view, the next thing is to try to separate them. And again, the tweezers are very, very good for this because they've got a nice sharp little point, but it's not too sharp. And I'm actually separating a muscle right here. There's sort of a border, and I'm separating it. And I can do the same on this side. Remove a little bit more tissue. I think you can see that right there. Okay, so there's a muscle, small, yep, but it's visible. This is something that's called the levator scapulae ventralis, okay? And basically what that does is it lifts the scapula or levates the scapula. And so the scapula is in this area, and there's the levator scapulae ventralis right there, okay? Now in your shoulder area, you have a muscle called the deltoid. You're probably aware of that. It's a large muscle, helps to lift your arm. The cat has a similar situation. Their limbs are organized a little bit differently. They have some separations of muscle. Like I said, we have a deltoid. They have several deltoid muscles. And one of them is called the spinodeltoid. And this muscle, so there is the levator scapulae ventralis, and right below that is the spinodeltoid. And I think you can see that pretty well. It sits there, it goes at an angle. So again, this is something where if you want to remove a little bit more fascia, you can. And I'm going to try to define the muscle just a little bit more by doing that. Okay, so there it is, right along that line there, and that's great. Okay. Now, this muscle below it, which I'm going to take a little bit more tissue from so that you can see it, try to get some of this fat off of there. Try to define it a little bit more. It's very, very large. I'm removing a little bit of superficial muscle here. But I'm talking about this muscle that's below the spinodeltoid muscle. It's this large muscle right here. And this is something that actually helps, again, to move the arm, and it's called the latissimus dorsi. So the latissimus dorsi, which you might be familiar with from your own body if you've done any weightlifting or anything like that, it's a large, powerful back muscle, is right here. And this is defined pretty much by this little border that I'm moving my probe along this area here. So we've got the latissimus dorsi, the levator scapulae ventralis, and the, what was it? The spinodeltoid, which is this one right here. So we've got those three muscles pretty well exposed. And that's basically what you'd be doing throughout the entire surface of the cat, is removing connective tissue, exposing muscles, defining them by separating them from other muscles, and then making your identification. And that's essentially how and what we do with the cats. Well, that's about what we were going to accomplish here today with the demonstration of the dissection. We've kind of worked in the shoulder area here. It took me about 10 minutes or so. It could take you that length or considerably longer. You know, you're going to be new at this, and so that's definitely going to impact on how long this takes. Overall, this dissection process that we would do for the muscles would definitely take you several hours. Now, that might be one class period. It may take you 2 class periods to do that. But once you've done that and you've cleared off the connective tissue, you've identified the muscles, you'll be able to effectively study that for your exam. So that's essentially what we're aiming towards here, is to be able to do that. Some areas are easier, some are harder. And I'm definitely not trying to explain all the intricacies of dissection. We'll be doing that in class. Okay? So once we've gotten to this particular section, essentially what we want to do is get our material put away. So the very first thing I'm going to do is just pick up my implements. I'm just going to stick them back where they belong. In this case, it's in a little beaker here. And the cat, of course, is going to go back in the bag. Keep in mind, again, we have 2 bags that we're going to be working with. And I've kept my bag close by here, so it's right here. You know, hold it open, lift the cat, again, sort of from the feet. And see if I can get this in there. Fairly smooth. And we've got the cat back in this bag. We've got another bag, and again, we're trying to keep the fluids and things from getting separated from the cat, so I'm going to try to get it into the other bag. Okay? So that's about it. It's not really any harder than that. To finish up with the cat, you do want to tie it. And it's not like a resealable lunch bag or something like that. although that would be nice. We don't have that. We're going to use some string, and I'm just going to put it around the edge of the open end of the bag. See how this works here? And really just tie it, just any old kind of, way you tie your shoe. Put a little bow in here. That might make it easier for you. It's going to be easy for me or not. It might make it easier for you when you try to open the bag back up if you can just untie it rather than cutting it. It's kind of hard to do with the rubber gloves. There we go. That's not real tight or anything like that. That's the idea. Okay? The other thing that you can do at this point, and this is important actually for you, this will be your specimen. You'll be working on this with other people, but you're going to need to keep track of your cat. So we have these grease pencils, and basically what you want to do is write something on the bag. And what you can write on that bag, I try not to censor this too much, but basically you want to put some information that identifies this as being your cat. So you might put your name. I'm going to write Dan there. Some people write the name of the cat, and if they come up with creative names, that's fine. So we've got our cat, and we've marked it, and pretty much we're done as far as what we need to do with these cats for today. We're just going to go ahead and put that away, and when you come to class, I'll tell you where. I'll show you how the specimens are put away, and it will be available for you next time. We don't have to refrigerate it, do anything like that. The preservative will take care of that. So that's essentially what we need to do to finish up. The last thing, though, and I don't know if you can see this, but when you lift up the cat, there's a little bit of fluid on this tray. You also need to wash your tray, okay? And you're really responsible for that. Somebody within your group is going to have to make sure that your area gets cleaned up. So you're going to need to take this tray to the sink, just sitting behind me here, wash it out, get it some paper towel and cleanser, and also clean off your tabletop. Also make sure that your tools are put away, and any tissues that you've removed from the cat, you definitely want to take care of those. As I said before, you wrap that up in paper towel, and that goes into a garbage can. If you've done that, then the table looks clean like it was when you came in, and the next class is going to be happy to see that, and that would be very, very good. So I hope this exercise has helped you to learn a little bit about the lab procedures, hopefully make you feel a little bit more comfortable with it. The one thing I can tell you is if you do feel a little uncomfortable with it, you will definitely, in my experience, get more comfortable as time goes on. One class session usually helps a lot for people to feel secure that what they're doing is a reasonable thing to do, and I think that people relax a lot after the first class. So otherwise, I'll be around in person. I am your instructor, so you can contact me, email me, or just stop in and see me if you have any additional questions. Thank you very much. See you in class.